Dr. Eileen Davila, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. More than 80% of eligible residents are now vaccinated, and we are continuing the steady progress to get to the province's goal, which we share, of 90%. On December 14th, 2020, the very first vaccine dose was administered here in Toronto, and we began as a city the unprecedented task, and a task of unprecedented scale, of trying to vaccinate millions of Torontonians, something never before done on this scale. Just over 100 days ago, June 15th to be exact, we announced that we had 20% of our eligible population fully vaccinated. Just over 3 months later, we are now at more than 80% of eligible Torontonians fully vaccinated. We know it's going to take time and effort to get to 85% and then on to 90%, but we are already on our way. As anyone who's ever run a marathon or a business campaign or an election will tell you, it's the last miles that are always the longest ones. Every day, as a result of that challenge put in front of us, there are dozens of Team Toronto clinics happening across the city where people are continuing to get their first doses, their second doses, and now even some COVID-19 vaccine boosters for eligible residents. And on top of that quiet and steady effort, we launched the Days of Action and the Shop and Vax clinics to help continue our success in getting people vaccinated. I want to thank the media for covering these events so that people know about them and can take part. It's important, and I'm confident that it makes a difference in the turnout at these vaccination clinics. These efforts are going to continue as we work non-stop to help people have access to the vaccines. I'm proud to announce today that this Saturday we will be holding Vax 25. This is a one-day citywide vaccination push in all 25 wards, with approximately 35 clinics in data-driven locations where we are working to increase vaccination rates. Along with our community ambassadors and organizations, we are working with every member of City Council to help promote these locations in each of their wards. The clinics include malls, they include health centres, pharmacies, community hubs, hospitals, and college campuses. And the entire point of Vax 25 is to give people in every single ward in the city and every part of our city an opportunity to get vaccinated this Saturday. If you need your first dose or your second dose, there are 35 clinics across Toronto at the ready trying to help you to do the right thing. The vaccine is safe and it represents the best protection we have against COVID-19. It won't just protect you, it will help your loved ones, your co-workers, and many other people at the same time, our collective health. Please make no mistake, while COVID numbers have stabilized for now, they are not at zero, and our best experts have told us there is still a risk, especially as the colder weather arrives and more people spend more time indoors and in group settings. While some are inclined to be critical or of projections which still suggest extreme caution in our behavior, the record reflects that throughout the pandemic, these projections have been directionally right far more often than wrong during the course of the pandemic. If we want schools and businesses and restaurants and entertainment venues to stay open, which I believe we all do, whatever it is we have to do then, getting that vaccination number up and respecting public health guidelines must be our course of action. That is true for me, that is true for all of us. These continue to be priority one, respecting public health guidelines on a continuing basis and getting the vaccine numbers up. We have seen what can happen if we allow ourselves to be taken off this course. The province's proof of immunization system, which is now in place, is needed if you want to dine in at a restaurant or work out at a gym or go to a Blue Jays or a Leafs or a Raptors game. Now that we have it, I think the vast majority of people understand the practical need for it and the need for it in order to protect each other and protect our collective health. I want to thank the vast majority of people who are complying with the proof of vaccination requirements, both business and individuals. You are doing the right thing. You are helping us to make sure that this system is a success, and that in turn will help us to avoid another lockdown and protect and preserve our collective health. Knowing it does impose some additional responsibilities on businesses with lots to do already and lots of times to recover from, most people have accepted it. It is working, and I, for one, am grateful for the sensible, rational approach people are taking to this. Make no mistake, things overall are going well. Case counts have stabilized. Dr. Davila will have more to say about that. Economic activity is up. Transit ridership is up. Our streets are slowly coming back to life, and businesses along with them, especially local businesses. Our arts and culture and sports scenes are coming alive. Investors are picking Toronto as a place to create hundreds of new jobs. More good news just this week. But we must see this through. Now is not the time to rest or to be satisfied. It is a time to be on our guard and to be redoubling our efforts to get our fellow residents to get vaccinated and to follow public health guidelines. I now invite Dr. Davila to prepare to present her report for today.
Thank you, Mayor Tory, and good afternoon. Before going into today's COVID-19 update, I would like to just make a few remarks as we are on the eve of the National Day for Truth and Reconciliation. Public health works in partnership with First Nations, Inuit, and Métis peoples, so we often have the privilege of experiencing the uniqueness of Indigenous cultures and ways of knowing. There are few people who have been so immeasurably wronged, and yet who retain such great capacity for resilience. I want to acknowledge the first National Day for Truth and Reconciliation, the survivors and intergenerational survivors of the residential and day school systems, although it is difficult to find words that do justice to all this day is meant to represent. In terms of COVID-19, the Mayor is right that we're on the right track and that our progress forward needs protection. While we're seeing comparatively modest case counts at a 7-day moving average below 150, we are again on the verge of a risky and uncertain period in the pandemic. If transmission rates stay the same, Toronto Public Health is modeling daily case counts at around 130 cases per day in early December. If we were to see a 20% increase in transmission rates, we model 600 cases per day by early December. On that basis, we would see almost 20,000 cases in December. Before then, cases would have risen consistently, probably aggressively, throughout the fall. It would make for a very complicated holiday season and New Year. Bearing that in mind, we have been fortunate in terms of the cases in schools, given the potential risk. At last count, there were 13 active school outbreaks and 143 investigations underway into suspect cases. This out of roughly 1,200 schools in Toronto. This is further proof that vaccines work, that masking works, and that distancing measures work. Nonetheless, there is a significant population of students, those under age 12, who are vulnerable because they cannot be vaccinated at this time. At this time, children between the ages of 4 and 11 are seeing weekly infection rates of approximately 64 cases per 100,000. This situation should change when, as anticipated, regulatory authorities approve vaccine for children between 5 and 11 years of age, and we can begin delivering vaccinations to them. As has been reported recently, scientific assessments of COVID-19 vaccines in 5 to 11-year-olds have found this is a safe course of action that will offer protection against disease to children and to the rest of us. We understand that protection for one is protection for all. Throughout the city, it would be easy to take a more relaxed view and to mistake current case counts as an indication of what is to come. While our modeling at Toronto Public Health and new modeling released yesterday by Ontario's COVID-19 Science Advisory Table Both show the potential for wide ranges from best to worst case scenarios. Nothing is guaranteed. And experience tells us that in terms of case counts, that we should anticipate that after Thanksgiving weekend, and once the cold weather sets in and we see each other more in indoor settings, that COVID cases will rise yet again. Currently, there are approximately 189,000 people between the ages of 30 and 49 who are eligible but have yet to be vaccinated. They aren't the only people, but as an age group, they paint a telling picture. It's reasonable to assume that they will become infected with COVID-19 and likely with the Delta variant. Many of them are parents. Our data shows that at present for children, the most common setting for infection is at home. If too many of the unvaccinated get sick at the same time, it could be catastrophic for the health system. We're seeing elsewhere in Canada what happens when the Delta variant gains the upper hand on a large scale. It explodes. The consequences are painful, and in healthcare, they force potentially devastating choices for healthcare staff about who gets care and who doesn't. That scenario in Toronto is unnecessary. The majority of those unvaccinated can be protected from illness by changing their status and getting vaccinated. It's only too late once you're sick. So for the foreseeable future, choose wisely, carefully, and selectively when it comes to getting together and celebrating. Wear your mask and keep your distance when in public and especially in crowds and when indoors. Plan the safest Thanksgiving you can. It's too bad we have to urge caution again. But once more, this year, caution is a must. I hope that next year we'll really have something to celebrate. For those of you who are unvaccinated, change your status. Please, get your vaccinations. The Delta variant is out there, and you're an easy target for it. Looking at the calendar, we can see that we're approaching the holidays and seasons where COVID-19 can run rampant if we don't stand in its way. My concern is that those who are vulnerable will fall victim. The consequences of that, COVID-19 has shown us, are unpredictable. It doesn't have to happen, and it can be prevented if we make the right choices now and through the fall and winter that preserve the success that we're currently seeing. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila. Good afternoon. Before I provide my update today, I would like to begin by extending my congratulations and thanks to everyone in Toronto for achieving the impressive vaccination rates that we have achieved together. With more than 80% of our eligible residents now fully vaccinated, and more than 85% of eligible residents having received their first dose of COVID-19 vaccine, we are moving even closer to our 90% goal. I'm deeply appreciative of everyone who has made the effort to get fully vaccinated against COVID-19, and for the incredible number of people who have and continue to work so hard to make that possible in our city. Thank you, one and all. As the situation with COVID-19 in our city continues to evolve, we continue to respond and plan accordingly. we continue to operate 5 mass COVID-19 immunization clinics that are strategically located across Toronto. These clinics are located as follows: Metro Toronto Convention Centre, Scarborough Town Centre, Woodbine Mall, Cloverdale Mall, and Mitchell Field. Each of these clinics are open from Tuesday through Saturday from 1 p.m. until 7 p.m. Our Metro Toronto Convention Centre, Scarborough Town Centre, Woodbine Mall, and Cloverdale Mall clinic locations are each able to administer 1,080 doses of COVID-19 vaccine daily. Our Mitchell Field clinic location is able to administer 360 doses of vaccine daily. In total, more than 23,000 doses of COVID-19 vaccine are available each week in our city-operated clinics alone, with many more doses of vaccine being available in Team Toronto partner clinics as well. All 5 of these clinics now operate as walk-in clinics only, and no appointment is necessary. Both Pfizer and Moderna's mRNA vaccines are available in all 5 clinics. Our Team Toronto partners, supported by our Toronto Public Health and City of Toronto teams, are also operating a number of hyper-local, mobile, and pop-up clinics each day across our city. Details on each of these clinics are available on our website at toronto.ca/COVID-19 as well. The Province of Ontario recently implemented the mandatory proof of vaccine requirements in accordance with regulations made under the Reopening Ontario Act. Since that time, city staff have worked hard to put responsive processes in place that both meet the requirements of the regulations while also providing as good an experience as possible for our residents and our businesses. Our coordinated enforcement teams continue to respond to complaints and concerns, bringing an education and assistance first approach to this important work. In general, the majority of the issues our teams are seeing arise out of confusion or where people haven't brought the required documentation with them. I encourage everyone to bring your proof of vaccine certificate and identification with you when you are attending indoor facilities that may require proof of vaccination. A digital copy of the proof of vaccine certificate is also acceptable. Our staff continue to work with businesses and residents to ensure that safety is maximized and the requirements of the regulations are complied with. When a situation escalates or where there are public safety risks, security staff and/or Toronto Police respond and engage as required. As always, enforcement action is only taken when the investigating enforcement officer determines it is warranted based on the specific situation at hand. I would like to once again thank everyone for their continued patience and understanding as we all work together to keep services and businesses running to the greatest extent possible, while also doing all we can to prevent the spread of COVID-19. Our COVID-19 Strategic Command Team, Immunization Task Force, and our Demobilization and Recovery Command Team all continue to work every day to ensure that we have responsive, nimble, and scalable plans in place as the COVID-19 situation continues to evolve. Please continue to make toronto.ca/COVID-19 your first choice for accurate, timely, and reliable information on vaccinations and the response to COVID-19 in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions, and just a reminder to reporters that we will unmute you on this end. And our first up is Shalima Maharaj from Global News. Shalima, go ahead, please.
Hi there. So thank you so much for taking my question. My first one is with respect to parents at a couple of East and Toronto schools who've launched their own rapid COVID-19 testing program at their children's schools. What is your take on parents taking it upon themselves to launch these types of initiatives?
So thanks for the question. You know, first and foremost, as a parent myself, I can appreciate parents' concern and their interest in making sure that their children are in environments that are as safe as possible. So I think that that's something that we all have to keep in mind and can certainly understand. Testing, as you may recall, is actually under the provincial purview. And as I understand it, they are currently focusing their testing resources on those areas where they feel the value is the greatest. And this in particular is in respect of exposures to known cases. But it's also my understanding that the province is actually looking at what different circumstances they might deploy various testing modalities to, including the type that you've described here in these schools in East Toronto. So certainly I will stay tuned with that which is happening at the provincial level and stay attuned to the discussions that are happening there. And of course, please know that we at Toronto Public Health are in active discussions and are actively involved with our school board and school partners themselves to do everything we can to keep that in-person learning environment as safe as it possibly can be, given that we are in the midst of a pandemic.
And my follow-up is for Dr. Davila. I know bearing the current vaccination rate in mind, you did say it would be a mistake to take that current rate and take it as an indication of what is to come. But people obviously will be gathering in larger numbers this holiday season. We have that long weekend not far off. Considering the number of restrictions that were in place last year versus what we have in place this year, what is your level of concern this year relative to the last couple of years that we've had to endure this?
Well, certainly this year we have the advantage of vaccination and we have the protection. Many of us have clearly taken up the opportunity to get the protective benefit of vaccine. But there is, in fact, Delta variant, which we know is quite highly transmissible, and we still have a significant proportion of our population who remains unvaccinated, some who are eligible and have yet to be vaccinated, who we're seeking to convince, and of course, the younger component of our population who is not yet eligible to receive vaccine and therefore susceptible. So my advice to people is to still exercise caution, unfortunately, this Thanksgiving season. And you know what that means is keeping those gatherings relatively small, to use masks as much as possible, take advantage of outdoor spaces and open windows and doors as much as possible, reducing the likelihood of any kind of transmission. And as I mentioned in my remarks, it's my sincere hope that by next year we'll be able to have more significant celebrations and perhaps celebrations more like we're used to having them from before there was a COVID.
Right, thank you very much. We'll go next to Mark Douglas from 680 News. Go ahead, Mark.
Thanks, Brad. Thank you, Brad. A question for Dr. Davila. As we get closer to that amazing goal of 90% of the city fully vaccinated, I never hear the phrase herd immunity anymore in any of these discussions. And I wonder if 90%, if double vaccinated, fully vaccinated, is 90% actually the level that we would call herd immunity? And is that phrase something that is generally shied away from, fearing that if people in the public hear that Toronto has achieved herd immunity, now I don't have to try anymore, now I don't have to worry anymore? Is that a factor?
Mark, what I would say is that, while there are targets that have certainly been set in terms of, what we're aiming for, I think at the end of the day, when I look at the numbers and when I think about what would be optimal for us as a city, it would be to get as many people vaccinated as we can. And certainly as that younger population, those who are 5 to 11 years of age, are hopefully soon to have a vaccine product that's available and for them to use and to get that protection of vaccine. My hope will be to vaccinate them as many as we can. So, while 90% is a wonderful figure and certainly one that we've heard about both at a provincial level and here at a city level, if we can get higher than that, I'll take higher than that, because we know that these vaccines are safe, they're effective, and they are our best protection. That doesn't preclude the need for public health measures and those good practices you've heard me speak about for many months now. But certainly I'm really interested in seeing us drive vaccination coverage as high as we can get it, because that's really what will confer the best benefit to all of us.
Thank you. A question for Mayor Tory. Quite a reversal we saw from TTC Union ATU Local 113 today on their opposition to the city's or to the TTC's mandatory vaccination policy. Mayor Tory, can you comment on what did City Hall or what did the TTC do to convince or to sort of put pressure on the union to change their to make that change and end their opposition?
I think if you just strip away the rhetoric and you strip away the political considerations and you strip away the press releases, what you have here, I'm very heartened by the fact you have now a willingness on the part of the union and the TTC to work together to push those numbers up, to get people to disclose their vaccination status, and then hopefully to work on the people who are hesitant for any reason to get them vaccinated. So in the end, I think we're on a better course now. I think this is a good thing, and I think it results from, I guess, people just thinking about their respective positions, and I know there have been some discussions going on, but it's a good result that will hopefully allow us to continue to make progress on something that I think is important to the operators who've done such a great job for us, but also to the public who travel on the TTC.
All right, thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey, good afternoon, everyone. I had a question I was hoping both Mayor Tory and Chief Pegg could speak to. We've seen several databases and maps floating around, circulating to show people which businesses in the city and beyond are not actively checking vaccine passports. And I appreciate, Chief Pegg, what you had to say about approaching this from an education first position, but it seems like there are businesses that are perhaps intentionally trying to skirt the new provincial rules. And I'm just wondering if you can speak to whether, Mayor Tory, the expectation is those businesses be fined, and Chief Pegg, how you are dealing with those outliers.
Well, I won't speak to the question of whether people should be fined, because that's a decision to be made by police officers ultimately, or bylaw officers who would investigate and lay charges as appropriate, and obviously the courts. What I will say is this. The number of businesses, even the number that are speculated to be involved in these organizations that are resisting the duly implemented laws and regulations with regard to vaccination proof, is actually really small, compared to the total number of businesses that would exist, for example, in the City of Toronto. And I just believe that it's very heartening that businesses who face some additional complications as a result of having to implement this vaccine proof requirement are doing so. They're doing so with the resources they have, and that the vast majority of people, and the vast majority of businesses are doing that, the vast majority of people who are their customers are quite willingly, and I think with a degree of simplicity, following along. And that's what we need to encourage people to continue with, businesses to make their effort to carry out the required inspection, and people to do what takes, I know from my own experience, a few seconds to show them your phone or a piece of paper. And so I think that's what's really important to focus on, is the vast majority are doing just exactly that.
Jennifer, I'll start by just echoing what Mayor Tory indicated, that I'm very pleased and very heartened by the fact that every single day that our coordinated enforcement team are out on the street and are responding to questions and concerns and complaints. Literally thousands and thousands of businesses and residents are found to be and are every day operating safely and in compliance with regulation. And that first and foremost deserves our thanks and deserves to be said. We are continuing to respond to receive complaints as they come in. Our coordinated enforcement team, which of course includes Toronto Public Health, Municipal Licensing and Standards, and Toronto Police, are responding to those complaints. Again, I'm very pleased by the fact that a very small number of formal warnings at this point have had to be issued. We have not had to lay any charges in response to the investigations that have been completed, and I think that that just speaks to the overall atmosphere and the overall compliance rate that's out there. Like I expressed in my remarks, in general and commonly what we're experiencing is there is some confusion and some misunderstanding still with respect to the requirements. We are able to provide some assistance in clarifying those things and working with businesses to make sure that they have the understanding and the tools that they need to comply. So we will continue to respond to complaints as they arise, but I would just, again, extend my thanks to every business owner in the city who works so hard to operate safely and in compliance, and with every resident and visitor and patron who are also complying. It's heartening to see so much effort.
Could I just put Brad, what the chief just said as well into some numerical perspective. We've had just over 500 complaints in a city of 3 million people with thousands and thousands, tens of thousands of businesses. We've had just over 500 complaints from all sources, Toronto Public Health, 311, the police, and that's over the course of a week. I dare to say there are other subjects that come up in the course of pandemic or not on which we get more complaints. And so that is, to me, is an indication that everybody's trying hard to do the right thing. The businesses are and the customers are, and that's the way we'd like to keep it. But that is a relatively small number of complaints, notwithstanding these reports that there are all kinds of people who are claiming not to be complying with the law.
And so just to follow up, Chief Pegg, I hear what you're saying, both of you, that there are these businesses that they're perhaps outliers, but are the enforcement teams going out aware of some of these maps? I mean, I was sent one, it's just, a Google map that people seem to be sharing on social media. And are they, rather than following complaints, are they actively seeking out some of those businesses to ensure that if there is misinformation, that they are resolving that, and if they are actively skirting the rules, that there's some kind of enforcement there?
So Jen, those, I can tell you that I have not personally seen those maps. I will endeavor to actually look that up on social media. I'm curious about that. Our teams, the processes that are in place with respect to triaging and responding to complaints as they are received is complaint-based. So the complaints are received. Generally, 311 is the correct means for people to file those complaints. 911, of course, is reserved for situations where there are public safety risks, crimes in progress, that type of thing. So we receive the complaints. They are triaged and dispatched, if you will. Our enforcement teams will respond to them on a priority basis based on the information that's provided in the complaint. And then, of course, they will take the necessary action that they find when they arrive. But in direct response to your question, generally speaking, we are complaint-based, and our enforcement teams are working both proactively, so out in the community every day, certainly engaging with businesses and with residents and visitors and patrons from a proactive education standpoint and offering assistance, but also responding to complaints as they are received, as I say, generally through 311.
All right, thank you. We'll go next to Samantha Beattie from CBC News. Samantha, go ahead, please.
Sorry. This question's for the mayor. So the regulatory framework for rooming houses will be at council this week and next. And you said in July that you'd meet with councillors one-on-one to address their concerns. I was wondering, what have you done since then? How have the regulations been tweaked, if at all? And do you think you have enough support to get it passed?
Well, thank you for that question, Samantha. I'll just say, since the last meeting, I have been engaged continuously in meetings with many members of the City Council and discussions with them about what is one of the most complex issues that has come before me, certainly during my time here, complex in many different respects. Those discussions are still ongoing. I will also say that we're receiving a considerable amount of input and opinion from local residents and local residents associations on this issue, and that we're still endeavoring to have something that can be put in front of the City Council, whether it's the exact recommendation contained in the earlier report or something modified that could address the issue. But I'm not in a position to say at this moment exactly where we'll end up with this when the Council meets.
And then I have just another question about the vaccination passport program. So would you say that it's working, and are you concerned? So Jen talked about the maps, but we're also wondering if you're concerned about the proliferation of social media sites, including Ontario businesses against Health Pass, saying they will not check for the passports.
Well, I'll comment on that, and then Chief Pegg may wish to as well, or Dr. Davila. Again, if you look at the actual number of businesses in these websites and social media platforms that are proliferating, the number is actually very small relative to the total. The vast majority of hardworking, law-abiding businesses and people are following what I think they've come to understand is a very practical regulation that is in the best interest of our collective health and in the best interest, quite frankly, of keeping those very same businesses open together with schools and entertainment and sports venues. And so I think actually we've got a relatively small number of people who are capable of making a lot of noise, which one can do on social media, to indicate their dissatisfaction with this, and it's a free country. But at the same time, I think you have to look at the glass as being 99% full in terms of people abiding by the law, taking extra steps to do so, sometimes at sacrifice to themselves, and people who are quite willing to comply with what is a very reasonable expectation of them that they will show proof of vaccination on their phone or from their pocket when they go to dine in. You know, and again, people who don't want to go to a restaurant and have to show a vaccination proof to eat indoors can eat at home. People who don't want to show proof of vaccination to go to a baseball game or some other kind of a theater to see a movie, they can watch it on TV. They have a choice of doing these things. What we don't have a choice about doing here is fighting this pandemic and getting it over with so that schools, businesses, and other things can stay open, and so that we can get back to a normal life and preserve the collective health of the people of the City of Toronto. I'm happy with how it's going so far, and I think all attempts to build up the number of people who are resisting are, I think, exaggerated.
Okay. You have anything to add, Chief?
Brad, I'll just comment that in my experience throughout COVID-19, social media has proven itself, I don't think this is a surprise to anyone, but proven itself to be a very effective means of disseminating important good information and factual information. And, you know, to name only one by way of example, you only need to look at things like Vaccine Hunters Canada to know the positive impact that positive, proactive, productive social media can have. Unfortunately, throughout our response to COVID-19, we've also seen fewer, but some examples of the very negative use of social media. So I would just comment that social media, a very powerful platform, we're aware of it, and it is unfortunate that some folks still choose to disseminate false or harmful or hurtful information and treat people very negatively by way of social media. I certainly wish that wasn't the case, but it's something that we have become accustomed to throughout COVID-19, and I believe we have responded to very effectively.
All right, thank you, Chief. Our last question is from Sean O'Shea at Global News. Go ahead, Sean.
Hi, good afternoon. I just want to return to Jennifer Pagliaro's question regarding enforcement. I realize that you want to put a smile to the question, and I understand that, but the reality is there are a lot of businesses openly flouting and advertising that they're not going to be following the rules. I'm at one, and we're going to be at others. Why is it still the case that you're educating people about these things when everybody should know the rules, rather than actually enforcing, ticketing, and charging, so that you're sending a signal to those who are law-abiding and other consumers that the city is taking this seriously? If one of you could address that, please.
The chief will address it as well as myself, but I just want to start off by commenting on this. Through the pandemic, we've seen this amazing kind of back and forth where on a Monday, people will be saying, why aren't you out giving more people tickets and enforcing the law? And on Tuesday, when somebody's actually given a ticket or two, they'll be saying, what are we running here? Some kind of a police state with giving tickets. The reason the educational approach, I think, has been taken from day one on a number of these different areas is because sometimes these rules as to what people are expected to do, how often they're expected to ask, and so on, are not clear to people, as clear as they might seem to us, meaning journalists or elected officials or public servants who work in this area every day. And I think we generally operate in many areas on the basis that people should be given a warning first and a bit of education before they're given a ticket. So it's a balancing act. I'm not the one as an elected official that directs the police and bylaw people as to sort of how often they educate versus how often they give tickets, but I have had the experience of having to explain on Monday why there are no tickets being given, and on Tuesday why, when there are tickets being given, there are so many being given. And I think that the job is very difficult of those who are involved with law enforcement to find a balance and to do what they think is right in each individual circumstance.
Sean, what I can add to that is, as I said before, our coordinated enforcement teams are very actively responding to complaints as they are received. It is incumbent upon, and it's important that we wouldn't want it any other way. The way that every enforcement process takes place is the enforcement officer who is involved in the particular investigation of any particular complaint uses her or his best judgment in the circumstance to determine what the appropriate response is. Of course, we always prefer to educate and assist first with the overarching goal of achieving compliance. Where the enforcement officers determine that that is no longer appropriate or is not appropriate in the circumstance, they will and have taken enforcement action, as Mayor Tory said, throughout the response to COVID-19. We have our municipal licensing and standards and Toronto Public Health staff, that component of the coordinated enforcement team, have continued to respond and will continue to respond to these complaints, and have taken formal action by way of issuing formal warning notices, which is an important part of the enforcement process that primarily our MLS officers will embark upon. There is also the response by the Toronto Police, and of course Toronto Police are involved on an as-needed basis and in response to issues where there are public safety or public order concerns or an indication where crimes have been committed. And Brad, I know that Inspector Moyer is with us. He may wish to comment further from a police perspective.
Inspector Moyer, are you able to add to that?
Yeah, I can. We haven't had many calls, and of the calls we've had, we've been able to divert them to the city. But where the police have attended, I think one of the messages that we keep having to reiterate to people is, first and foremost, we try to manage people's expectations. And I think the city's done a great job about that, sending that message out not only to the customers, but to the businesses. People know and expect when they arrive at a business that there's an expectation about self-disclosure and the pressure that's put on the business, whether it be someone standing by themselves at the front of the store, the restaurant, having to deal with the pressure. But nevertheless, it's incumbent about people to sort of work collaboratively with this. And what the police have found is that when we get to these businesses is that it really, the messaging that's delivered can put out any angst or aggression with people just by the communication piece. And we have not been in a position where we've had to take the ticket book out at this point. And the final point I'll make is this, that really this is, as we've gone through the COVID process and worked through many pieces of legislation, it's without a script. We're trying to adapt with public safety and public health as our platform in everything we do. So we're finding that the public has been quite compliant and understanding, and I'm hoping that that's the direction that we move that we get moving forward as well.
Follow up, Sean?
Just briefly, with respect to restaurants, I asked this question of the health department earlier, and they referred me to this press conference. Would it not be appropriate in the case of restaurants who are deliberately flouting the rules, intentionally not asking for this kind of documentation, to be able to take away their right to be open in the same way that you can remove their right to be open if there are rodents in the kitchen, or there are other public health violations? Doesn't this constitute a public health violation if they're deliberately not following the rules?
Sean, I'll start, and then Dr. Davila may wish to comment from a DineSafe perspective. The way that the Reopening Ontario Act is constructed from a penalties and fines perspective is it is in fact fines-based. So the enforcement mechanisms and the penalties that are available to our enforcement teams under the Reopening Ontario Act are related to fines. Those fines range from $750 for an individual in what is referred to as a Part 1 or a ticket, up to as high as $10 million in the case of a corporation. There's also potential jail times in play for upon conviction for violations under Reopening Ontario Act. So our enforcement teams that are responding to these complaints under the Reopening Ontario Act, of course, are confined to the construct and the provisions within those acts, and that's the action we take. Dr. Davila?
Yeah, I think the chief has covered it. I think fundamentally what he's saying is that the measures that can be taken by way of enforcement are in keeping with the legislation and the relevant regulations. So that's exactly what you're seeing here. Over and above that, of course, depends on what the staff actually are witnessing on the ground. So they are making the best decisions, using their best judgment, in keeping with the existing legislation and regulations as the situation they see in front of them unfolds, and as they make their assessments on what they see on the ground.
All right, thank you very much. Thank you for joining us, everybody. That concludes today's briefing. Please stay well.